The number is actually fixing to shrink a bit with a recent announcement, but the number of clinical measures, you can sort of divide them up into clinical versus procedural, right? Complaint levels, call center availability, things of that nature. The number of clinical measures that are used in Part D is relatively small, and that's essentially all PQA measures. So we have measures related to adherence, measures related to statin use in patients with diabetes, as well as a couple of polypharmacy and opioid related measurements. But that number of measures, is five this year. Getting measures into the star ratings program is kind of a lengthy process. There's a lot of stages that they have to go through. There's sort of the JV squad, if you will, that there's public reporting with no money on the line. There's actually confidential reporting before they even do public reporting. So you have this very long on-ramp. And generally speaking, at any given sort of moment, a measure can have some less than perfect aspect because almost no measure is actually perfect, such that the stakeholders that be are uncomfortable getting it all the way to be a star ratings measure. Now, especially these days, more measures is not typically viewed as a good thing. Mostly what you hear about is reductions in measures, fewer, better measures that focus on things that we're most interested in, and outcomes focused measures versus process, although we do tend to have a lot of process related measures because that's our sort of wheelhouse, right? Medication use, ultimately, of course, you're interested in an outcome like ED use, but we specialize in medication use, and medication use is part of the process of treating a condition.
Right.
So we tend to live there. But I would say it's a combination of long, arduous road for measures to enter, general sentiment, towards having fewer measures, both from the plans and CMS, especially on the provider level. I think there was this, whoa, we've got a million measures thing, and we're spending so much money on this measurement ecosystem that we have to pull back.